हेलो एवरीवन। आज का हमारा टॉपिक है फीटल स्कल। Compared to an adult skull, a fetus skull is a larger proportion of its body. Adaptation of this fetal skull with maternal pelvis is one of the important things need to take place during the process of delivery to avoid further complication or adverse effect. Now, parts of fetal skull. Fetal skull consists of two frontal bone, two parietal bone, two temporal bone, and one occipital bone. And types of suture and their location on fetal skull. Sutures and their location. Frontal suture between two frontal bones and coronal suture between frontal and parietal bone, and then lambdoid suture two parietal bone and occipital bone, and sagittal suture is between two parietal bones. Let's now see parts of fetal skull in the diagram. Next, vertex. It is a quadrilateral area bounded by the anterior fontanelle and coronal suture in front, the posterior fontanelle and the lambdoid suture behind, and longitudinal line passing through the parietal eminences laterally. Next, brow or sinciput. It is an area bounded by the supraorbital ridges in front, anterior fontanelle, and a coronal suture behind, and longitudinal line passing through the frontal eminences laterally. Next, face. It is an area between orbital ridges and root nose to the junction of the chin and neck. Next one is fontanelle. Two frontal bone form sinciput of the fetal skull, show in diagram or structure. The space between the bones of the skull in nature is suture, and the area where the sutures meet is known as fontanelle. These sutures and fontanelle help the fetal skull to mold during the process of delivery. First one fontanelle is anterior fontanelle. Another name is bragma, formed at the junction between the frontal coronal and sagittal sutures, since it is at the junction of four sutures. It is like a diamond in shape. It is closed by 18 months of age. It is the largest fontanelle. Its length is 2.5 cm and width is 1.5 cm. Next one fontanelle is posterior fontanelle. Another name is lambda. It is formed at the junction between the lambdoid suture on either side and sagittal suture. It is like a triangle in shape. It is closed by the age of 2 to 3 months of age. It measures about 1.2 into 1.2 centimeter.